All right. Hey there, everybody. I'm Dr. Ian Mahar with the Prevent Cancer Foundation, a nonprofit organization that, among other things, funds grants for scientists doing novel research focused on preventing cancer. Today, we're here with one of those grant recipients, Dr. Alicia Allen. Dr. Allen is an associate professor at the University of Arizona, and her grant research is focused on preventing cancer by reducing smoking rates, particularly in women. Dr. Allen, huge thanks for joining us and telling us more about your research.
Yeah, definitely. Well, thanks. First of all, thanks for having me. And like you said, I focus on female-specific factors and how we can use those to help women quit smoking. So things like pregnancy, the menstrual cycle, use of hormonal contraceptives. So that's the broad picture of the work I do.
Sure. Um, so huge thanks not just to yourself, but also to the folks that are joining us live. For anybody that's with us live, please feel free to drop a question in the Discord chat, and we'll try to get to it. Dr. Allen, can you give us a brief, sort of broad overview of the particular project for which you received funding from the Prevent Cancer Foundation?
Yeah, definitely. Um, so the goal of this project was to look at the acceptability and feasibility of using Depo-Provera to help women quit smoking. So we basically wanted to know, would women be willing to use that hormonal contraceptive, and if and how accessible were the methods that we're using in the study. So the reason we wanted to look at that is we know in the natural menstrual cycle, it looks like those ovarian hormones play a role in smoking behavior. So we thought if we could use Depo, which basically blocks ovulation for 3 months and stabilize those hormones, that might help women quit smoking as opposed to having to deal with hormones that go up and down, kind of a cyclical pattern over the month. So that was the overall goal.
That's great. I find that to be really fascinating. That's an area that I didn't know much about. So I was really curious reading into your reading into the research that you've been working on. When it comes to hormonal interventions for addiction, does it seem preliminarily like we're more likely able to prevent or reduce intensity of cravings, or on the other hand, that we're able to boost people's sort of innate ability to resist or overcome cravings or addiction?
Ooh, that's a really great question. So to date, most of the research on hormones in smoking have focused on the hormone progesterone. So just for context, what happens with progesterone in the natural menstrual cycle is it's pretty low, like right in the first half, then after ovulation it goes up a lot. Um, and so we've looked at progesterone both in men and women and also in pregnant people, which also has a very high progesterone, to see what happens. And so before I tell you what happens, I'll share that they've done a lot of work with this in animal models. So with animal models, they can do things like remove the ovaries, and so then the animal doesn't have an estrous cycle anymore, and then gives them exogenous hormones. So in the animal literature, it's really clear that progesterone helps or prevents against drug-taking behaviors. So things like they if there's drugs in the cage, the animal will use less of it if it's receiving progesterone. If they have to do some task to get to the drug, for example, they do lever pressing. So if they work harder to get to the drug if they have progesterone. So all of that suggested, in the latter half of the menstrual cycle, in women, they might smoke less, right? So when we look at the menstrual cycle, it's not cut and dry. It's kind of messy. And I think that's because there's a lot of other hormonal and physiological changes that happen. But in men and women and pregnant people after they have their baby, we've given them progesterone to see what happens. And what we've seen is with women who are not pregnant, it helps them quit smoking and reduces their craving. And similarly, in people in the postpartum period. So if someone quit smoking during pregnancy, they receive progesterone after they have their baby, they're less likely to go back to smoking and also report less craving. And then interestingly, or maybe not, depending on your perspective, it did not have that same effect in men. So it just didn't seem to help men as well as women.
So that's actually something that I'm super curious about. A lot of your work sort of focuses on, let's say, the intersection between sex and gender and addiction rates or use of drugs of abuse. And this is something I don't know much about, so I'm super curious. What are the general sex differences in terms of rates of use of nicotine or other drugs? And how do we know whether we can attribute some of these to hormonal differences in particular?
Yeah. Um, so I guess so. First of all, if you just look at the prevalence of use for cigarette smoking and for other types of substances, say like marijuana, alcohol, men have a greater prevalence. So more men use than women. Which at first glance that might suggest that men are more vulnerable to substance taking and misuse and eventually moving all the way up to a substance use disorder. But in reality, what actually happens is men are more likely to try substances once. And then because of that, then they can kind of continue on that path to develop problematic substance use. Um, but women are actually more vulnerable. So if you have a man and a woman who both try a substance once, and everything else is equal, the woman will be more likely to go on to problematic use than the man. Um, so it's kind of it contradicts what seems to be going on when you just look at the numbers of people that are using. So yeah, women are more vulnerable for all types of different substances.
I saw something really similar to that, I think, if I'm interpreting correctly. While I was sort of researching before talking to you, I saw a report from the National Institute of Drug Abuse that mentioned that men and women, smokers in particular, are similar in terms of how motivated they were to quit or in the number of quitting attempts, but that women were about 30% less likely to successfully quit, if I'm understanding that correctly. If that's right, why do you think this might be?
Yeah, no, yeah, you're interpreting it correct, and that's really a big driver of my work. I think there's maybe two big elements to this, at least two. Number one is for a long time, and probably to some extent till still now, much of the um, pharmacotherapy treatment and research that goes on is based in men. So they, especially say 20, 30 years ago when they were developing these medications, men would be more likely to be in the trials. And so then we would figure out what is more effective in men as compared to women. So I think the ways that the medications that we can use to help people quit smoking are a little bit more effective in men, like you mentioned. Um, the other thing that's probably very related is the fact that men tend to smoke for nicotine reinforcing factors, such as they have a craving. They've gone for a while and they have a craving, so they want to smoke to alleviate that craving. In contrast, women tend to smoke for more secondary reinforcement factors, we call it. So things like reducing feelings of stress or improving improving an adverse move, like if someone is feeling down. Weight control is another big one. So I think in addition to the medications being, more developed for men, they address kind of the physical withdrawal and that happens when someone stops using cigarettes. They don't necessarily address, at least not as well, those secondary factors that women tend to smoke for.
Right, that's fascinating. I never would have thought about that in terms of differences for the motivational reason. So a lot of your research, understandably, focuses on addiction in women. Just out of curiosity, do we know anything about the effects of testosterone or other male-associated hormones on either smoking or related topics?
Yeah, as far as I know, there's not much out there. I actually tried to look that up to kind of prepare for this. And what we know is that smoking can change the metabolism of testosterone. So if you compare males who smoke to males who don't smoke, the males who do smoke will actually have more testosterone because the body is breaking it down at a slower rate. But what we don't know much about is how that testosterone level impacts the smoking behavior. So that's still developing. I have seen a little bit of research of, I don't know how much we should trust it, take it with a grain of salt, that suggests that higher testosterone is associated with more use of cigarettes to sort of manage anger and sort of adverse mood like that, so which kind of makes sense. But I will say that's one direction I want to go is, both men and women have testosterone, and I think really what we've done to date has been limited on just a couple hormones, and in reality that's not the way our bodies work, right? We have one hormone may increase, and that sets off a series of events, and other hormones increase or decrease. And so I feel like we need to look at it in a bigger picture, and take other hormones like testosterone into account.
I think that that leads really nicely into something else I was really curious about. Is that one thing I've looked into in the past is the effects of stress on the brain, and I know from your from some of your previous research, you've looked into how stress can affect smoking rates for pregnant women, and then stress involves its own hormones like glucocorticoids like cortisol. What do we know about how stress in particular affects smoking, and is that relationship between stress and smoking different between men and women?
Yes, another great question. So we do know it's kind of it has this bidirectional relationship that happens, and this is for both in men and women. Um, so it's a little bit of a chicken and an egg scenario that can happen, right? Like, so when you're stressed, you may smoke more, but then when you smoke more, your physiological stress response system is kind of hampered, and you have less of a favorable stress response. So you're not going to get those helpful hormone, flooding your system to help you manage the stress, which then might, of course, lead to more stress and more smoking. So it's this really tricky cyclical pattern. Um, and there are sex gender differences. And if I recall correctly, it's more of it's a stronger sort of one-to-one relationship in men as opposed to women. And I have to, of course, think that that might be a little bit related to the hormonal factors. Like, we know stress and stress response varies over the course of the menstrual cycle, so it would make sense that the relationship with smoking is, of course, going to vary. So, yeah, so it's a huge factor for sure.
Right. You mentioned the menstrual cycle there, and in your earlier responses about as being part of the research. Do you find that because premenopausal women's hormones can be cyclical, does that mean that women's smoking behavior or their ability to quit might be influenced by the phase of their cycle? And maybe that has sort of a practical application in terms of when someone might be more or less likely to make a successful quitting attempt.
Hmm. Yeah, so the jury is still a bit out on that. So to date, there's been, at least to my knowledge, 6 different studies that have looked at what menstrual cycle a woman quits in and how that relates to how well she does when she quits. And in brief, 2 of them that used nicotine patch, it looked like the follicular phase. So that's basically right when the period starts to maybe a week or so after the period starts. Those women, if they used the nicotine patch, did better than people who quit about a week before the period. Then there were 2 more studies that did not use the nicotine patch, and those results were the opposite. So the women who quit about a week before the period did better than the women who quit about a week after the period. Then there were also 2 more that basically showed no difference between the groups. So the general consensus right now is actually two takeaway points. One is, it seems like the use of the nicotine patch may lead to different results, and that could be related to, we know that estrogen changes the metabolism of nicotine. So maybe when the estrogen is lower, the nicotine patch is more effective, just because it's being metabolized at a rate that's similar to men. So that's one thing, is if you're going to quit with the patch, you could potentially try it about a week after the period. If you don't want to quit with the nicotine patch or other nicotine replacement therapy, a week or so before the period might be the best bet. But all that to say, the other big takeaway is, I think we've come to a consensus sort of as a field that there's a lot of variability from person to person, and even cycle to cycle within a woman, in terms of the length of her cycle, what the hormone levels are, all of those things. Like we were just talking about stress. Stress can impact the hormones and the length and all of that. So basically, we're at a point where we're saying it's maybe not the best bet to look at menstrual phase. We should probably be measuring the hormones directly to find out what's impacting the outcomes.
Right, that makes a lot of sense. It sounds like it's a developing area, but those are really useful takeaways for the folks that might be wondering that about their own smoking behavior.
Yeah.
I'm curious about, in a sort of a more general sense, you know, a lot of your research overall is focused on hormonal influences on drug taking behaviors or response to addiction, including nicotine and opioids. What initially sparked this interest for you, and why do you think that prior to you finding this opening in the research to target that it hadn't been studied prior to you diving into it?
Yeah, this is a kind of a funny answer. I think it was really just kind of serendipity. So when I was a undergrad in college, I knew I was interested in research. You know, I knew I didn't want to go to medical school. I came from a family that had several people in medicine, and I just knew that wasn't the right fit for me. And I also really liked math, so I ended up finding the field of epidemiology. So I knew that was, that's where I wanted to go. So I was, as an undergrad, just looking for a research assistant type job, sort of any content, and happened to get one with that focused on this very topic. So the first study I worked on was one of those studies I mentioned, looking at what menstrual phase helps women quit smoking. And I think it was one of those things that the more I learned, the more, I learned a little bit, and that led to like 10 more questions, and then that led to 20 more questions, and I sort of just kind of fell down the rabbit hole. So I actually started that job in 2001, and it's been, yeah, over 20 years now, which makes me feel really old, but over 20 years now that I've been continuously falling down this rabbit hole, and the more I learn, the more curious I become about it.
That's great. I always love seeing passionate scientists, especially that get to develop their ideas for 20 years. That's amazing. I had a couple of sort of broader, um, general questions about sort of the intersection between sort of the kind of research that you're doing and the goals of PCF in general in terms of cancer as a whole. I think a lot of research and public education efforts have gotten us to the point where most people today are aware that smoking cigarettes is a risk factor for cancer. I think it would be hard to find many people that weren't aware of that. But scientifically, what do we know about the mechanisms specifically by which smoking cigarettes leads to cancer?
Yeah, well, I'll admit, first of all, this is a little bit outside my comfort zone. So, but essentially what happens is the either the cigarette smoke itself, or there's what, like 290 plus compounds and chemicals in the cigarette smoke. So so when that's inhaled, and then of course it goes into your system, and it depends on the specific chemical and the specific type of cancer. But essentially what comes down to it is that ends up changing the way the cell develops, and then that's where the carcinogenous starts. Um, so yeah, so and that's why secondhand smoke, and even thirdhand smoke for that matter, can increase cancer risk, is because the more you're exposed to those chemicals and compounds, the more likely it is that that will happen in your body.
Yeah, no, that makes a lot of sense. It's great to be able to summarize that for a general audience. Um, Similarly, I mean, I think a lot of people in the general public have a lot of misunderstandings about cancer. I think when I was a kid, I was always hearing about, oh, this will be the person that'll cure cancer, or this will be, that's sort of like a singular goal. Can you kind of try to summarize for a general audience that might not really necessarily know the complications of doing that? Why, sort of in lay language, why cancer has been so difficult to cure or treat compared to other diseases, and why we need organizations like PCF.
Yeah, absolutely. So I think it really comes down to the fact that it's not this simple, one-to-one equation, right? Like, so it's not this one thing, like smoking, for example, does not cause all cancers. And then additionally, it's not one type of cancer, right? So there's all these different risk factors, and then there's all these different types of cancer, and the path from one risk factor or a combination of those risk factors is going to be different for the cancer outcome. So, you can't, come up, well, at least to my knowledge, it's going to be very individualized in terms of how we can prevent specific cancers based on the type of cancer and the risk factors. So it's not like it's going to be very difficult, if not impossible, to find a one size fits all prevention or treatment approach.
Sure. It seems like we're entering an era or within an era of individualized medicine where it's not a singular problem, it's many individual problems. So I think that makes a lot of sense. We did have one question come in from our PCF folks, one of which wanted to know they wanted to know what kinds of places a non-research person could go to read up on research in your field if they're very interested in it.
Yeah, well, I love this question. Well, of course, I have to plug our own research website, which is Renew. It's renew.arizona.edu. So Renew stands for Recovery through Engaging and Empowering Women. So we have information about our studies and the results of our studies. So that would be a great place to check. Otherwise, there's also, if you're interested in women's health and women's specific factors in terms of quitting smoking. I think it's, I should double check, but I think it's, there's a really good one. I think it's women.nih.gov. Ooh, I should know this off the top of my head. No. Ooh, I know there's a good one. Let me just find it really quick that I always refer to for people. Oh man. Well, actually, while I'm looking here, another good one, if you're interested in women's health and kind of what's happening in women's health, there's an Office of Research on Women's Health, which is part of the NIH, and that's at orwh.od.nih.gov. Gosh, I'm sorry, I'm totally blanking on this one that I give out all of the time, but it's, oh, you know what? I think I have it. Hold on.
It's fine. We
Yeah.
can also add it to the chat or as an overlay later if we need.
I found it. It was just
Okay.
in the tip of my tongue. But it's women.smokefree.gov. So that's
Great.
the one that NIH puts out. That is like the best recommendations and tips based on all the research that's available today. So there's things like a texting program, build your own quit plan. It talks about what smoking medications are available, which actually I'll put in one more little plug. If you're a woman who wants to quit, the most effective way to do that right now is using the medication varenicline. So that has been shown to be equally effective in both men and women. Does not matter what part of the menstrual cycle you're on. So I'll put that plug in there too. But yeah, definitely check out that website.
Great. That's really useful. I appreciate the resources. I just had a couple of questions that were a lot broader, but I thought were really important because I think a lot of folks that get passionate about these topics in the general public, and they might be people that are interested in the mission of PCF or kind of understanding where their donation dollars might go if they're interested in donating. For any folks that are watching that are unfamiliar with how scientific grants in particular work, can you tell us a bit about what the funds in these grants go towards and how instrumental they might be in creating research projects that might otherwise not be possible?
Yeah. Trying to think of how to sum this up. So I think like for, maybe I'll just share about sort of what my career path has been. And I think it's fairly typical. So, typically, someone will sort of pursue their own sort of research program, right? And so what they'll need to do is apply for these funds. And oftentimes when they're first applying, the goal is to just get some what we call like feasibility data, right? Like, can we actually do the science we're proposing? So that might be things like, for example, using the study I got from this mechanism is looking at, are women interested in using the Depo-Provera shot? Can we recruit enough people to join our study? Are they going to do all the surveys we want them to do, that sort of thing. So, you start with a grant like that and you show, hopefully, that people will do what you want them to do. And then the next step might be more of what we call an efficacy trial. So it's looking to see, again, using this as an example, if we give women Depo versus placebo, does one of those two groups, hopefully the Depo in this case, help women quit smoking more? So the things that the grant would fund would be things like, usually much of it, probably half to 75%, at least in my case, funds the staff. So we have research assistants who, help design the recruitment ads, do a lot of interviews over the phone to make sure people are the right fit for our study, and then meet with people weekly or even more sometimes to get the data that we're interested in. And then the rest of it goes to various supplies, so like the Depo medication, mailing people the surveys in the like a blood pressure machine even, we'll mail those out to people. And then things like the hormone assays. So people collect blood samples for us, and oh, here comes my cat to join us. And then that gets sent out to the lab to be analyzed for hormones. So I think that's it in a nutshell.
Great. No, that's very much appreciated. I think a lot of people don't know what goes on the other side, so it's great to get a glimpse into that. This next one's kind of open-ended, but whatever you can provide for your own opinion here. But often when people in the general public donate to support health research, such as in fundraising events like Games Done Quick, they're motivated by the loss of a loved one due to the disease that they're donating for, or a concern about the well-being of particular people in their life that they care about. And they're hoping donating might bring us a small step closer to a larger goal of either preventing, eliminating, or reliably treating a particular disease that they're donating for. When it comes to cancer, do you think we're getting closer to that goal in particular?
Yeah, I do. I think I think well, I think yeah, I have a lot of different things to say about this. So first of all, I think I definitely relate with, the desire and the need to act on behalf of a loved one who's passed. That's one of the main things that has motivated me in my own career. So, I'm very thankful for the people who do that, and I think, our community is at large, because that's really what's driving a lot of these advancements. And I think I personally am optimistic about the direction this is going. I go to, like, we have our University of Arizona Cancer Center, for example, just had a regional conference, and I got to hear about someone who is developing a, uh, a way to sort of basically prevent the HPV virus from going on to cervical cancer. And so, I hear a lot of these really exciting stories about how, it's getting closer and closer to treat and prevent. And then also things like, the HPV vaccine, there's success stories already happening. And so, um, yeah, so I think we're making a lot of progress. And I think also with the current administrations, I know they're putting a lot of funds into cancer. And so bottom line is I'm optimistic and thankful for those who are jumping in to participate in this fight.
That's great. I really appreciate that. Speaking of jumping in, we just had a message from our viewers in the chat. And the question is, could you talk a little bit about the next steps for your study and the journey from human trials to publicly available treatments?
Yeah. Um, well, let's see.
It's a broad question. It's a
Yeah.
yeah.
Well, I will say we do have one study going on now that's similar to what we have here. Like I mentioned, the progesterone for preventing cigarette smoking relapse. So we have that efficacy trial going on now. So I'm really hopeful that will translate into something that the public can use. So the progesterone that we're using is actually an FDA approved medication that's used to treat perimenopausal symptoms in women, and it's a natural progesterone that when we did a pilot study, really had very limited adverse effects. There were some issues of fatigue, and that was really about it. So I'm really hopeful about that. And then in terms of working with women of reproductive age who have a natural menstrual cycle, um, so I think we're kind of exploring what hormones are our best bet. So I think we learned from this study that going for taking the medication for 3 months wasn't necessarily something that women wanted to do, especially one with, admittedly, the Depo-Provera can have some side effects that women are not real keen on, like the weight gain or changes in fertility over the next year. So we're trying to look at what other medications can we use. So there's a progesterone that's used in to prevent preterm birth that only lasts for about a week. So maybe that might be helpful. So bottom line is we're still exploring, and I believe then the next step, which admittedly I have not done this myself yet, but let's assume we do get some really strong effective results, then it would be working with the FDA to either approve a new medication or to expand, the on-label uses of a medication so that it can be prescribed. So that's a bridge I haven't crossed yet, but hopefully soon we'll be able to.
That's great. It's something to definitely look forward to in the future. And thanks again to the folks that asked that question. I had one final question for you. It's a lot more functional, just because I thought it would be important to focus on actionable items, especially because we're talking about preventing cancer with PCF. You're working on preventing cancer by preventing smoking. In terms of functionality, are there any other suggestions you might give to smokers or maybe the public in general? But what we might do to reduce smoking, either for individuals or societally, in terms of support or other action?
Yeah. Um, well, I think number one, there's been a lot of progress made in terms of preventing secondhand smoke exposure. Like we don't see that in buildings and that sort of thing. So, I think that's good, and I would recommend it in homes and cars as well, especially when there's kids or other people with potentially fragile health that just basically if you want or need to smoke, go doing it in an outdoor space is going to be helpful for those around you. And then in terms of quitting smoking, so that's it's a huge challenge. So I think the last numbers I saw is it took anywhere from 10 to 20 times for somebody to actually try to quit to be able to quit. So, it can be really difficult when you try that many times and you relapse and you have to try again. But my recommendation is, don't let that stop you. So every time you try to quit, you learn something new, and eventually you're going to have a toolkit that's ready to go and get you all the way through. So, take advantage of the medications that are available, the state quit lines that are available. There's a lot of resources out there that you might at first glance not want to use them, but they are evidence-based, effective ways to help you quit smoking. So, talk to your doctor, go to these websites, and you can do it.
That's an awesome answer, and I hope that helps some folks out there. That'll do it for us. Firstly, I should say thanks to the PCF folks behind the scenes. Thanks to that cat for appearing, because that was another highlight. Thanks to everyone in the chat, and most importantly, Dr. Allen, thank you so much for giving us your time and insight. I really appreciate it, and I appreciate all of your efforts to prevent cancer. It's really fantastic that you're doing this work and that you're able to give us your time and expertise. I'm really it was a really exciting conversation for me, and I'm very grateful to you. So thanks again.
Yeah, my pleasure. Thank you very much for having me. It was fun.
Yes, definitely. Uh, all right, for everyone that's watching, thanks again, and take care. Keep an eye out for whatever you heard about this event, as we'll have future PCF events in the future, and all the best.